let's just get down to the first question that everybody always wants to know. Let's talk about the numbers. How many positive in the county? How many positive do we have in our facility? It's sad, but we always just want to keep up with how many patients have passed away and the number of patients that have recovered.
Okay. All right. Well, and it is a constantly evolving condition that we're in right now. Although we definitely are seeing some slowing down and some stabilization of the outbreak. That actually I was just meeting virtually with about 150 of our Quia Delta leaders. This was our monthly leadership team meeting, and with the help of our incredible IT folks, we went to a go-to webinar, like what we're doing here today, and it's amazing to think back that it was the week of March 4th that we really started to experience the presence of the coronavirus in our community. We actually collected 4 specimens that week of March 4th. So today we're collecting more than 80 a day and have collected almost 3,000 over the 7-week period. So we are in the 7th week right now. It's amazing. This is our 6th community meeting, so time has been flying. Okay, so as of yesterday, Wednesday, April 22nd, I'll start at the county level. There were 441 confirmed positive cases throughout Tulare County. And I'd just like to remind folks that the current estimates of the Tulare County population right now are somewhere between 450 and 500,000 people. So important to kind of keep that in perspective. Sadly, there have been 25 COVID-19 related deaths and 66 confirmed cases of recovery. Now, I think it is important to also understand that if a patient comes in for something completely unrelated to COVID and passes away from that, if they had a massive heart attack or a massive stroke or something completely unrelated to COVID, but if they did test positive for COVID, they are counted as a COVID death. So I know for a fact that some of these 25 patients did not pass away because of COVID, but they were positive, and so they count towards that. All 25 deaths have been people that have been over 65 years old. Even though we've had a lot of young people contract the virus, none of them have passed away. California has 33,261 confirmed positive cases and just shy of 1,300 deaths across the state. As of this morning, we have 28 patients that are positive for COVID and that are currently in Quia Delta that have been admitted. 8 of those 28 are in the ICU. The remainder of them are on 2 South and 3 West, and then just recently we converted our 11-bed Broderick Pavilion into an intermediate critical care unit, specifically taking care of COVID patients. So 28 in-house this morning. That is down from 32 that we had in-house yesterday. Patients are being discharged home, which is a wonderful thing to see. Unfortunately, and I'll talk a little bit about this later, just looking at some of the questions that have been posed, of those 25 deaths that have been experienced throughout Tulare County, 17 of them, we've had 17 total deaths at Quia Delta. So of the 25 that have passed away countywide, 17 of them have occurred at Quia Delta, and 10 of them were Redwood Springs nursing home residents. So on a very positive note, I've mentioned in a couple of our last broadcasts, there is a predictive analytical modeling tool we call Qventus is the vendor. And Qventus is a well-known national healthcare consulting firm. And a lot of hospitals across the country are using this predictive modeling platform to help us predict what patient demand might look like under this COVID pandemic, and particularly what we might experience in the next 45 days. So it's actually projecting the number of new cases that we'd experience, the number of additional deaths, and what our daily census might look like in the medical surgical areas, in the ICUs, how many ventilators that we might see. I think I'd shared with you in the past that just maybe a week and a half or so ago, the model was predicting for the entire Kern, Tulare County area that we may not see the apex of this pandemic until somewhere around mid-July, which was very disconcerting because we were kind of in the middle of April at the time, and the thought of having to endure this for 3 more months and just the fatigue that would put on our healthcare resources, on our physicians, on our staff was a bit discouraging. But I want to commend our community for the incredible job you have done with maintaining social distancing, washing your hands, not touching your face, sheltering at home. I've seen places like Costco and Quality Meats and other places that have continued to implement better and better practices. Now I went to Quality Meats, I think it was on Saturday, and I stood outside in a line spaced 6 feet apart from everybody else, and they only let certain number of people in there at a time. Whereas before they were still, letting everybody in. And you now see, in virtually all the essential workplaces that have stayed open, folks are wearing masks, both the people that are going in and the people that work there, and all of those things I think are helping. As reflected in the Cuventus information we just saw yesterday, which suggests that we actually are in the apex right now. That today, Thursday, April 23rd, that we have now reached the apex and that we are likely to stay plateaued for about a week, maybe a week and a half, and then begin to come down the downside. So that's very encouraging, very promising. Like many hospitals across the country, and what you might have heard Governor Newsom talking about, like those other hospitals, we have now started for the potential reopening of elective surgery. Dr. Mark Wiseman, who's our medical director of our OR governance committee, Brian Piercy, our director of surgical services, Dan Elaine, our vice president over surgery, are now working with our team of surgeons to begin identifying scheduled cases that they would do over the next 4 weeks. So not a specific date, but what would you do in week 1, week 2, week 3, week 4? And so we don't know yet when week 1 would start, but it would be at that point that we would start doing elective surgeries again. It could be as early as May 18th. It might be more likely around June 1st, but it's going to depend on what the current conditions indicate, and are we truly at that apex, that plateau. So.
Yeah.